Welcome to the Medical Fitness Podcast. I'm David Flench, President and CEO of the Medical Fitness Association. Today, we have a very exciting episode in collaboration with the American Heart Association. Joining me as co-host today from the American Heart Association is Cheryl Brown, Senior Program Consultant Professional Certifications. Hi, Cheryl.
Hi, thank you so much for having me today. It's my pleasure.
Yes, great to have you. And we're diving in to how digital health is improving access and quality of care in the management of heart disease, and what that means for you, our listeners, fitness and wellness professionals. So joining us today as our guest is Dr. Ritu Thamman, passionate leader in digital health innovation, women's heart health, and cardiovascular care. I'm going to give a biography on Dr. Thamman. She is very accomplished in this area. So uh, here goes. Dr. Thamman is a cardiologist and associate professor of medicine at the University of Pittsburgh School of Medicine. She served on the board of directors of the American Society of Echocardiography and was the inaugural chair of the ASE's Twitter Journal Club and co-chair of the Industry Roundtable, a think tank for echocardiography and innovation. She is the founder and chair of ASE's Women in Echo. She's an advisor for the American Heart Association, Center for Telehealth, and served as ACC's co-chair for telehealth standards for consumer peripheral devices. She served on the ACC's Women in Cardiology Leadership Council and founded the ACC's PA chapter of Women in Cardiology. Her research work centers particularly for women and marginalized populations, focusing on mitral valve prolapse, mitral annular disjunction, and in innovative implementation tools for cardiovascular disease. Dr. Thamman is the social media editor for Circulation, Cardiovascular Quality and Outcomes, and the Journal of American Society of Echocardiography. She was the 2022 recipient of the Carl R. Furman Clinical Educator of the Year at the University of Pittsburgh and the 2021 American Heart Association Paul Dudley White International Scholar Award winner, and the Gerhard Hagenkirche Honorary Lecturer at the 2024 DJK Echo Congress. Welcome, Dr. Thamman. What an impressive list of accomplishments. We are so thrilled to have you.
Thank you so much, David. It's truly my honor and pleasure to be here with you all today. This is such an incredibly important area that we are going to be discussing, and digital health, telehealth, technology are all reshaping how we are approaching our heart health, especially as we're reaching out to more people, improving access, and ultimately improving patient outcomes, which is what we are hoping and focusing on in terms of building a healthier future for everyone.
Absolutely. Well, let's start with the basics. Tell us why digital health is so important right now, especially when it comes to heart disease.
Well, as you know, digital health encompasses a large rubric underneath it. And the first reason for that is that heart disease is still the number one cause of death worldwide. And in fact, that level of um, deaths are actually rising in America and across the world, especially in younger populations, age less than 55 over the last years. And we have numbers that the AHA has been counting for many decades. And the last numbers are from 23. And we know that we have problems in terms of access to care. It's unequal, and it's divided because of geography, because of socioeconomic status. We have time restrictions. And even just sort of the stigma of saying, "Oh, I have to go to cardiac, and get cardiac rehab or cardiac care." There's still this denial that is fundamental to the human experience that is part and parcel of this dilemma that we face. But with digital health, we can break and overcome some of these barriers because now we can use remote monitoring, we can use visual visits, and of course, we have a plethora of wearables and the technology, all driven by AI insights, meaning that more people can get the care sooner and faster, and especially in cardiac rehab. Now, this really started to explode during COVID. As cardiac rehab centers were locked down with the rest of things. And so we really had to pivot, even though we had been doing telehealth in the rural population for a decade before. It was really COVID that propelled us forward in terms of, hey, we have to pivot now because we don't have another choice. And we have all these patients that are otherwise stranded. So we did pivot, and I wrote an article actually around that same time emphasizing that not only can we continue the care and keep the access for our patients, but that actually when you use this digital tool, you can incorporate some other preventative strategies in terms of managing their hypertension, talking to them about their nutrition, their sleep, life's essential eights, in fact. And so these digital tools are game changers because we're meeting people where they are, not where we just want them to be. Come into the hospital, pay your parking ticket, pay for a babysitter, pay the tolls to come in, find the time from your work to take off, which a lot of people don't have those flexibilities, especially women. And so this is really very, very important.
Dr. Thalman, I know you're also deeply passionate about women's heart health. How does digital health impact women differently?
I think that's a great question, Cheryl. Women have a different relationship when it comes to accessing health and also taking on what the clinician is actually saying to them. And in fact, that's a key part of how they might accept whatever advice is being given to them. And in fact, women have historically been underdiagnosed and undertreated for heart disease, as you probably are well aware. And but if they actually had tools that are more personalized, that are handheld, that they can actually look at on their own time and not being tied to a certain set time, asynchronous videos, and ways where they can enter their digital data, track their maybe symptoms. It really encourages women to become empowered and engage earlier, hopefully, and therefore really take full ownership of their heart health, which is what we want them to do. And so all these apps, blood pressure cuffs that are digital, and these monitors, all these different devices that we have may be able to detect any issue earlier. And seeing is believing. So if you close your eyes and you don't go to the doctor, well, you don't know what your numbers are. And AHA has been a profound proponent of knowing your numbers. What is your blood pressure? What is your cholesterol? What is you know, e even more subtle things like, do you have heart rate variability? How much are you sleeping? All these are incorporated into life's essential 8, and these are really the fundamentals that we all need to know, especially women, because they're not being told by their physicians as much. They're not being referred for cardiac rehab as much. They are also, even if they make it into cardiac rehab, for example, they don't participate as long as men. They do not complete the full cardiac rehab duration as much as men. And so, therefore, their outcomes are obviously going to be poor because they're not really engaged. And it's not necessarily a personal choice as much as it is of many circumstances that lead to that inability to make it at a set time, at a set place, which may also encumber, a copay fee, which it's adds up to be a lot of money when you have to pay the copay and you have to pay for parking and you have to pay for a babysitter if you have children. It's just, you know, it's such a difficult situation. And so these telehealth choices will reduce those barriers because you don't have to pay for childcare. You don't have to take off time from work, right? You can do it whenever because it can be asynchronous. And those sort of obligations really affect women much more so because they're usually the primary caregivers in their family. Not only with children, but even with aging parents. So I it's really imperative that we are all jumping on this bandwagon here to improve outcomes for women especially.
Ritu, you mentioned life's essential eights a couple times, and I want to make sure our listeners have a good understanding of what that is. I believe it's a American Heart Association initiatives around a couple of major areas of health behaviors and various health factors. Would you want to go into that? And Cheryl, being part of American Heart Association, if you want to add to it, I'm sure we can go that way too.
Cheryl, do you want to start?
Sure. Life's Essential 8 is an American Heart Association initiative. It does address those behaviors such as sleep, um, blood pressure, medication management and compliance, and other things as well. Ritu, I know you have more experience with Life's Essential 8 and research and outcomes around that. Can you speak a little bit more about Life's Essential 8 and some of the research and what it shows?
Oh, sure. There is a substantial amount of literature around knowing your numbers. So, for example, LDL cholesterol, for example, based on ApoB levels, it's a direct correlation, and it's just like smoke years. So we know that the longer you smoke, the you develop accumulate smoking years, and the longer that time, the bigger your risk. It's the same with cholesterol. The longer your cholesterol is high, the more risk it is. So it's a time related factor as much as it is just a level um, factor. Similarly, with blood pressure, you need to know what those numbers are, and you should be 120 over 80 for most, or less. And that again, the longer your blood pressure remains out of a normal range, the higher risk you are for developing not only heart failure, but stroke. And it's really the most deadly silent killer in the world. There's no other risk factor that is that prevalent and that encompassing. So those are some. And then, of course, you need to know what your weight is based on BMI. And in certain cultures, we also use a tape measure
Mm.
to measure circumference, abdominal wall circumference, because we know that a lot of fat that accumulates there is actually, the more substantial risk factor than we have realized in the past. And based on your genetics, you may be at a higher risk for example, at a lower BMI. For me, my background is Indian, South Asian, so our risk factor starts at a BMI of 23 versus for Caucasians, where it starts, you become overweight at 24.9. So those are things. And of course, sleep is the last number 8 that was added more recently because there is so much more evidence saying that you need that 7 to 8 hours of sleep, and it should be good sleep. And if you don't have that, that's going to affect your blood pressure, it's gonna affect your mood, it's gonna affect, how much activity you get done in a day. The other parts are obviously exercise, and that is a really key, part because exercise helps control your weight, helps control your mood, and exercise is medicine. That hashtag has gone viral for a good reason. We started even years ago a challenge after the ALS did the ice bucket challenge. We did a challenge on push-ups for several years, and we went back and forth on X now, showing that, you can do this anywhere, you don't need any fancy equipment. Anyways, so exercise is medicine. If we could make a pill, with exercise, we would all be extremely wealthy, but we can't, we just have to do it. Um, and then, of course, getting your fair share of right foods. And of course, that is again an access issue because we do have a lot of food deserts and people don't have necessarily access to the right foods, nor do they even know what they should be eating, although there is a trend now. Again, food is medicine trend, and HA is centrally involved with that, even beyond life's essential aid, as that is, a preeminent issue, and our new government, Mehmet Oz, has really expanded upon that, saying, we have to tackle that because that's so fundamental. So, all these digital health um, parameters that can be measured by these tools. They're not just for innovation. These are essential lifelines for people, including women who might otherwise have been, they fall through the cracks because they just are not followed up, or they don't get the kind of care that they really need.
I can remember that push-up challenge from several years ago when I was working at the Hancock Wellness Centers, and we posted videos of them. And so every year I get the video reminder that pops up, and I think that was a great one. You got to challenge other people to do it. That was kind of fun. So I'm glad you brought that up. That's a good memory. But switching gears just a little bit here, a lot of the Medical Fitness Association members are running virtual programs. Power Wellness is one of our industry partners and has several certified medical fitness centers that run post-stroke Zoom classes. So, um, you know, virtual cardiac rehab. How does that whole concept fit into this evolution?
I think that's a perfect example because, as I said, post or right around COVID, the virtual cardiac rehab just exploded because we found that it's just as effective because there was always this concern that, oh, that you have to come in person, otherwise you're not going to get the full benefit in terms of outcomes. And we've definitely shown that that is um, just as effective as coming in person in real life. So, and in addition to just remotely monitoring your blood pressure, heart rate, obviously with these new digital tools, you can have supervised exercise that is specified by time, but you can also have asynchronous videos. And you've seen a plethora of these apps explode, like the Peloton app and others, where, you know, there's just press the button and watch and just go along with the person who's giving you the instructions. And you can do telecoaching and you can do nutritional counseling. All of that can be done virtually. And so, certainly, stroke survivors, anyone that's post MI, heart failure patients, all benefit from having this continuity of care. And this digital tools are able to keep them more engaged, and they can continue to progress. And that's where the exercise physiologists and professionals really make a difference because, as you know, no matter where you start in this journey, whether you're post stroke, you're post MI, or you're perfectly healthy with maybe just some little bit of blood pressure problems, um, wherever you are, whatever your starting point, you're going to improve, right? So even if you're 90 years old and you just, are stiff, if you start doing and moving and doing and implementing these types of exercises, you will feel better and you'll live longer, which is just incredible. I don't think there's anything better than that. So, you know, that is really a central message here, that whether you're recovering from a cardiac event or you're trying to be preventative for a future one, if you have risk factors or no risk factors, even, this digital virtual world is going to keep you moving forward and improve you no matter where you are at the starting line.
I really like that. Yeah. Let's shift to the professional side. So my next question is why should our medical fitness professionals invest in certifications like the CPHA telehealth certification or the newest certification to be released in late May, the digital health in cardiac care? Why are those important?
Well, I think these digital tools are here to stay. We have them. It's virtual care is care everywhere, and it is now. It's not going away. We all need this, and so being skilled in this digital health means that you're future proofing your own career. And this certification coming from the AHA actually builds trust with referring physicians because we know that patients are in expert hands because you have the AHA brand and credibility behind you. And so that helps broaden your reach. Not only, could you have access now to anyone, so it could be patients who are outside of your geographical area, rural patients that, have seen so many hospital closures, including their cardiac rehab centers close. There may be other clients who are elderly, who maybe their mobility is limited and it's hard to get in and out of a car or get anywhere. It's so cumbersome. Or people who are really busy professionals, they're working all the time and they just can't get in to see you in person. And so you can coach and care for this very broad slice of American populations, which is so essential. And we know that AHA's CPAHA telehealth certification is the gold standard opportunity to gain practical, recognized skills for virtual cardiac care. And um, this soon to be released certification in digital health and cardiac care is really designed to help the professional identify the best use cases of these digital tools and technology as applied to patient client care and health coaching. And I can tell you that the AHA certification process, since I've been involved with that now for several years, helping to formulate questions, helping to actually hone the answers and the actual content. They are very meticulous, and the point is it's not just another checkbox, this certification. It's really more a gateway to serving more patients and serving them in the best way, with the highest standards. And I think people resonate with that because this is, backed by the AHA, and there is a long process by which these um, digital certifications have been developed over years and, tried and true. So,
I love how you mentioned credibility, and that's so important. I mean, everything that people who are implementing these programs and gaining the trust of the referring providers is so important. And so this additional training, I've always been a huge proponent of that. So it's great to see this available now.
I'd also like to add that we know in prevention and wellness that there's been this large movement to medicalize fitness, right? So fitness professionals, again, are gaining their credential, enhancing their expertise in this space in medicalizing fitness. And so I think these certifications really go hand in hand with doing just that for the medical fitness associations. We do know that our certifications, again, help with that credential. They expand your expertise, again, improve potential referrals from physicians and community providers as well. And I just wanted to speak a little bit more, if I could, about our telehealth certification. Again, it really goes through the basics of what telehealth is, the literacy of telehealth. And then we have core concepts, coursework that actually accompanies that certification in our special offer that we're doing now. With our newest certification that we're building, digital health and cardiac care, like Dr. Thamman referenced, some of the topics in there are so applicable to this population. We discuss motivational interviewing. We discuss what is required in behavior change and social determinants of health. We also have components in there about digital health literacy, what it is, a little bit about RPM, which is a hot topic now, and AI. So I think this certification, up and coming in late May, digital health and cardiac care, is very applicable to the members of Medical Fitness Association and gaining this credential and just really showing your expertise and your involvement in those who have chronic conditions or cardiac conditions. Thank you.
Yeah, so that's a great segue into the collaboration that Medical Fitness Association and American Heart Association have recently started. Do you want to go into that, Cheryl?
Sure. We are so pleased that we have just encountered this collaboration with Medical Fitness Association and American Heart Association. It's a collaboration that'll last for 3 years. The goal really is to come together and improve the education and skills of the professionals in the prevention and wellness space, as well as clinicians. Another goal really is to collaborate together to gather outcomes on these patients and clients, like Dr. Thalman referenced, and also to collaborate and provide that education and research, even some research into the outcomes of how certifications and some of our American Heart Association initiatives will impact the clients and patients that Medical Fitness Association members serve.
yeah, and just to add to what Cheryl just said, we are thrilled with this collaboration because, as you know, more than 80 to 90% of all disease is non-communicable diseases that are preventable. And so this really reflects a shared commitment that we have to build a world of longer, healthier lives through this innovation and access and standardization to excellence and care. And so this is a really key moment where we are empowering medical fitness professionals to really elevate the care because they're going to encounter these patients in their work every single day. You have patients that have, chronic diseases, hypertension, diabetes, obesity. They're going to be part and parcel of what you're taking care of already. And you have this potential to make an even stronger impact than you already are, which you by virtue of what you're doing. And of course, right now, since this is a new initiative, we're delighted to say that the CPAHA telehealth certification um, and bundled coursework for continuing education credit is free for a limited time. So I really hope you all join us together to create a better, healthier community and scale this impact and to change and improve heart health for all of our patients that we're seeing and working with, because you really can change their lives through sharing and engaging in this knowledge. And as you know, the sort of the future of care is this continual learning because there's so much data that's coming out. So whatever we learned, like for certainly whatever I learned in medical school, I mean, I have to read to, keep up. There's that's too old. And so this is a great way to keep that fresh and learning together, because patients are also are part of our communities, and so they find you online. They form their online communities as well. They learn from each other as we all share and learn from each other. And I think this is a really important part of this certification, because we are all coming together to for the betterment of our patients.
Yeah, and just to reiterate, the American Heart Associations have made this free for uh, Medical Fitness Association members, and so that's just for limited times. But still, this is something to for professional development and growth. Just a great opportunity, and it's why I'm so excited about this collaboration and bringing experts to our audience is certainly a big part of it, and so that's another great part of this collaboration. So, Cheryl and Ritu, thank you for your part in this collaborative work.
This episode of the Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. We're proud to announce our new 3-year collaboration with the American Heart Association, working together to improve heart and brain health through fitness. Now through June 30th, you can access free certifications from the American Heart Association to boost your skills and better support your clients and fitness facility members. Just head to medicalfitness.org, click the Certifications tab, and explore other certifications to get started. Don't wait. Level up your impact today with the Medical Fitness Association and the American Heart Association.
And so, before we wrap up, I want to make sure we have time to share some additional American Heart Association resources that are available to our professionals. So, I'm sure both Dr. Thamman and Cheryl can speak to that. But Rita, do you want to start with that one?
Sure. AHA has been pivotal for CPR training, as you know, with the movement after the sudden cardiac death on the football field when the Buffalo Bills was playing, was a real impetus again to sort of reinvigorate that program. But that has been around for a long time, and we've had tremendous visibility and teaching as a result, and hopefully saving countless lives. So that is one of our feature programs. Of course, we have lifestyle change programs. We have programs for hypertension management, cholesterol control, smoking cessation, weight loss. Again, going back to Life's Essential 8. There's a substantial amount of patient education materials. It's also digital, and these have been developed with uh, so much expertise based on our AHA guidelines and our own research. And it's, again, something that your clients can trust because it's validated. And we have advocacy and research updates so you can stay really up to date as to how we are approaching um, dealing with reimbursement policies. And the professional certifications are very broad. They're so across cardiac, stroke, telehealth, chronic disease prevention, all of which are really essential.
Thank you. Cheryl, anything to add to that on American Heart Association resources?
That was excellent. Thank you so much, Dr. Bauman. I was just going to add, just take some time to go to our American Heart Association website. Again, look up that Life's Essential 8. We also have a prevent calculator that actually calculates the risk of heart disease based on some of the very concrete numbers that Dr. Thamman shared earlier. And then again, with our professional certifications for now, we're combining that with coursework for CEs. So even if you don't need CEs in your profession, it's excellent coursework to take advantage of. But American Heart Association is the gold standard as far as hypertension, blood pressure monitoring, setting those guidelines. We've got tracking logs that your patients and clients can use. And then we also have great infographics about how to take accurate blood pressure measurements and readings with your clients. So just investigate our website. It is full with lots of resources for the public. Thank you.
Fantastic. Well, Dr. Thamman, any final advice for our audience as they are looking to integrate digital health into their programs?
Well, I think the time is now. Start small, but start now. Start today. You already know that this matters, and you know what you're doing is important, whether it's one-on-one coaching or remote group classes. Your work already has impact, and to just be open to this newer form of continuous learning that's digital health, that's going to keep on evolving, and we have to just evolve with it because we have to keep up, because this movement to improve cardiac outcomes for our everyone, for our country, for our people, is an enormous movement and challenge, and everyone is essential. So your voice, your leadership, your compassion as you share that with your patients is so important. And don't minimize that impact, because everything that you share, you're a trusted person in their lives and they will listen to you. And as you gain this incredible knowledge and share that, and they see the actual responses that they're getting, and they notice the changes, you have this very positive feedback loop. And um, that's really what makes every day so exciting when you're dealing with patient care. And that's what makes AHA's work, and research the gold standard behind that.
I love hearing the passion that you have for this, Dr. Thamman. So thank you for your incredible insights today. It's been great hearing everything that is going on, especially in the digital world. Um, and so thanks to our listeners for spending the time listening to this. Don't forget to check out the CPAHA telehealth certification, which is free for a limited time, as we mentioned. You can go learn more on the Medical Fitness Association website. Dr. Thamman, before we finish up here, a lot of times our listeners are looking to connect with our experts that are on our podcast. So, do you have a way that you prefer people to connect with you?
Sure. Anyone can find me on Twitter or X. My handle is at I am Ritu, just my first name. I am Ritu. And from there, you can, you'll be linked to my website directly on the Department of Medicine at University of Pittsburgh, and all that information is there. So that's the simplest way, and it's public. You don't even have to have an account or anything, but you can just go on there and find me.
All right, excellent. Well, thank you again. Thank you so much for spending this time with us. And till next time, keep changing lives, everybody, one heartbeat at a time.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.